There has been a 57% increase in COVID-19 infections in Jacksonville hospitals in the last week. An internal memo sent to Baptist employees about the jump in ICU patients that it is seeing with the virus described those patients as shockingly young. It also cited one local patient who had just died and was under the age of 40. Now, it's not just here. We told you earlier at the top of the hour that the number of new infections nearly doubled across the state this week compared to last week. Joining us now via Zoom is Dr. Mohammad Reza. He's an infectious disease doctor. Good morning, doctor. Thanks for being with us.
Of course. Good morning. Thank you for having me.
So, when the pandemic started last year, many people really thought that only older people and people with pre-existing conditions could get really sick from the virus, and that younger, healthy people would only have to worry about mild symptoms if they develop any symptoms at all. What's changed?
So what's changed is we have a variant that's quite infectious at this point. If you look at the variant, this Delta variant, it spreads much more rapidly. When compared to the original COVID-19, it's about 225 times faster in spreading. And when compared to that Alpha variant that we saw that's quite contagious from the United Kingdom, this is still about 60% more transmissible. So you have a virus that's a lot more transmissible, and it likely divides a lot more rapidly. We're seeing those infected with this variant have 1,000 times more copies of the virus in their respiratory tract. So with all that combined, you're seeing more and more people get infected, given how transmissible this virus is.
And we do know from local hospitals that the majority of the cases are, the Delta variant. That said, when it comes to this particular variant, you were also seeing most of the people, 99.7, I believe, across the country infected, are unvaccinated. Your message?
Yes. Yeah, we're seeing that, and that's true. First and foremost, people, please get vaccinated. These vaccines are effective. A lot of the data coming out from the United Kingdom, coming out from Israel, show that it's still quite effective. But at the same time, it's not 100%. And with something that's so infectious, those vaccines, how effectiveness does go down a bit. So using common sense, avoiding large indoor crowds, and keeping that mask handy. I tell patients that, if I had a pill that would prevent you from contracting any strains of this virus that was 50 to 65% effective, would you take it? And everybody says, yes, of course. No side effects, of course. That's what a mask does. It gives you that much protection. So that layered protection, wearing a mask when you're indoors especially, as well as getting vaccinated, you want that protection against this more contagious variant.
And it's interesting because I want to talk about masks in just a second, but I know that you've seen this in the hospital because when we talked to you earlier this week, you mentioned it, and I've heard about it locally in the community, and that is that some people who are vaccinated are getting reinfected. For those who are on the fence, who don't want to get the vaccine, they hear, well, people who got vaccinated are still getting sick. Are you worried that that will prevent more people who have not gotten the shot from getting it because they hear that story?
Yeah, I am. But the reality is, if those people had not been vaccinated, more likely they would require hospitalization, breathing support with a ventilator, or die from this virus. So this is preventing all those. It decreases markedly those poor outcomes for those that are vaccinated versus unvaccinated. I mean, predominantly we're seeing the hospitalization rate now, it's the unvaccinated. But some people that are vaccinated, people that may be immunosuppressed, whether they've had an organ transplant, they have cancer, their immune system is weakened, they may not have that robust response to these vaccines, that 94-95%. So those patients are vulnerable. So that's what we're seeing. But 98 to 99% are unvaccinated adults that we're seeing being admitted to the hospital at this point.
Do you think we need to go back to our county and around the area to requiring masks be worn?
At this point, I urge our citizens to use precaution and common sense. So when you have something that's so much more transmissible, you want as much layered protection as possible. First and foremost, get vaccinated, avoid large indoor gatherings. And we know masks work across the board, so why not use something that's available to us that will provide protection?
Dr. Mohammad Reza, local infectious disease doctor, thank you for your time this morning. We appreciate it.
Of course, thank you.